All right, now to the latest on the coronavirus outbreak. Governor Lamont says people 65 and older in Connecticut might begin receiving the COVID-19 vaccine within, quote, 10 days or so. But the governor says it all depends on the flow of vaccine into our state from the federal government. Lamont did acknowledge it could take longer. Statewide, nearly half of people 75 and older have gotten their first shot. Well, as we talk about the vaccines rolling out to a broader audience, people still have a lot of questions about doses. Joining us now to talk about this is Dr. Henry Anyimadu, Infectious Disease Consultant with Hartford HealthCare's Hospital of Central Connecticut. Doctor, welcome back.
Thank you for having me.
Always a pleasure. What is the status of the vaccine distribution right now?
So, as you rightly said, today is February 4th, and we are currently in phase 1B, and we are scheduling individuals who are older than 75 years. According to the CDC COVID tracker, about 366,000 people have received at least one dose of the vaccine in Connecticut. That puts us around 10%, but only about 3% of people have received 2 doses. We all know that we can do better. Every shot counts, but it counts even more when it's given sooner rather than later.
All right, Doctor, we're hearing that the second dose of the vaccine seems to cause some more prominent side effects. What are the side effects and what can people expect?
So the common side effects of both of the messenger RNA vaccines include injection site pain, fatigue, muscle aches, headaches, chills, and sometimes fevers, all of which will happen within the first 7 days of receiving the vaccine. But the truth is, it all resolves within 2 to 3 days. And truly, these side effects are nothing compared to the actual symptoms that you get with COVID-19.
That's such a great point. Are there remedies to minimize the side effects of the vaccine?
If you do have pain at the injection site, you can use cold compresses or you can even exercise to ease it off. But if the pain is unbearable and you're having fevers and chills and muscle aches, you can definitely take acetaminophen or Tylenol or even ibuprofen, which should be fine.
All right, what are the more serious side effects and when should someone contact their doctor?
The most severe reaction to these vaccines is anaphylactic reaction, which is rare. It occurs in about 1 in 100,000 doses. But the vaccination centers are really trained to screen people who may have an anaphylactic reaction or may have had an immediate reaction. So if you've had any form of anaphylactic or an immediate reaction to a vaccine or any injectables, I think it's appropriate to talk to your clinician or your doctor before you consider getting the vaccine. We do know that people who are allergic to polyethylene glycol or polysorbate should not take the vaccine, because if you've had a severe allergic reaction to any of those constituents, which polysorbate is in the vaccine, so if you've had any of these, then you should consider talking to the doctor before getting the vaccine. And again, if any of these side effects persist beyond 3 days, you also want to talk to your physician, because you could have COVID-19. The vaccine itself will not give you COVID-19, but you could have COVID-19 by getting exposed maybe prior to getting the vaccine or even after getting the vaccine. So it's always important to reach out if you've had these symptoms for more than 3 days.
Excellent advice, Dr. Anyimadu. Thank you very much.
You're very welcome.